Ibandronate, also known as Boniva, is a medication used to prevent and treat certain types of bone loss, specifically osteoporosis. Osteoporosis causes bones to become thinner and more prone to breaking, which can increase the risk of fractures. This medication works by slowing down the loss of bone density, helping to maintain strong bones and reduce the risk of fractures. It belongs to a class of medications called bisphosphonates. It is commonly prescribed to postmenopausal women, elderly individuals, and those who have been taking corticosteroid medications for long periods. The recommended daily dosage is typically taken on a monthly basis, and it's important to take this medication at the same time each month on an empty stomach with a full glass of water. Before you start taking Boniva, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. It's important to follow the instructions closely to absorb as much of the drug as possible and reduce the risk of injury to your esophagus. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once a month on the same date each month. Choose the day of the month that best fits your schedule. Take this medication after getting up for the day, and at least 60 minutes before taking your first food, beverage or other medication. Do not take it at bedtime or while you are still in bed. Take this medication with a full glass, 6 to 8 ounces / 180 to 240 milliliters, of plain water. Do not take it with any other beverages. Do not chew or suck the tablet or keep it in your mouth to melt. Swallow the tablet whole. Then stay fully upright, sitting, standing, or walking, for at least 60 minutes and do not lie down until after your first food of the day. Wait at least 60 minutes after taking Boniva before you eat or drink anything other than plain water and before taking any other medication by mouth. It's important to note that certain medications such as quinapril, certain forms of didanosine, chewable/dispersible buffered tablets or pediatric oral solution, sucralfate and bismuth subsalicylate may interfere with the absorption of Boniva. Also, calcium or iron supplements, vitamins with minerals, and antacids containing calcium, magnesium or aluminum, as well as foods such as dairy products, such as milk, yogurt, mineral water, and calcium-enriched juice, may also interfere with absorption. Do not take these products for at least 60 minutes after taking Boniva. Remember to take Boniva regularly on the same day each month to get the most benefit from it. It may help to mark your calendar with a reminder. Talk to your doctor about the risks and benefits of long-term use of this medication. Continue to take other medications for your condition as directed by your doctor. Some common side effects of Boniva may include stomach upset, diarrhea, pain in arms/legs, or mild flu-like symptoms such as tiredness and muscle ache. These side effects may improve over time, but if they persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people using Boniva do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects such as increased or severe bone/joint/muscle pain, new or unusual hip/thigh/groin pain, jaw pain, or vision changes. Boniva may also rarely cause irritation and ulcers in the stomach or esophagus, so it's important to get medical help if you experience symptoms such as new/severe/worsening heartburn, chest pain, difficult or painful swallowing, severe stomach/abdominal pain, black/tarry stools, or vomit that looks like coffee grounds. Although a serious allergic reaction to Boniva is rare, it's important to seek medical help right away if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Boniva, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other bisphosphonates. Also, let them know about your medical history, including any issues with your esophagus, low calcium levels, or kidney disease. It's important to note that some people taking Boniva may experience serious jawbone problems, so your doctor should check your mouth before starting this medication. Be sure to inform your dentist that you are taking Boniva before any dental work. To prevent jawbone problems, make sure to have regular dental exams and maintain good oral hygiene. If you have surgery, especially dental procedures, inform your doctor and dentist about all the medications you are taking, including Boniva. They may advise you to stop taking Boniva before your surgery, so be sure to follow their instructions. If you are pregnant or planning to become pregnant, discuss the risks and benefits of taking Boniva with your doctor, as it can stay in your body for many years. Additionally, consult your doctor before breastfeeding, as it is unclear if Boniva passes into breast milk. Remember to always consult with your healthcare provider before starting, stopping, or changing the dosage of any medicines. Boniva may interact with other medications, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, this medication may interfere with certain lab tests, so be sure to inform the lab personnel and your doctors that you are using Boniva. This will help to avoid any potential false test results. As always, follow your doctor's instructions and guidance for the best results. If someone has taken too much Boniva and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 for emergency assistance, or contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center for assistance. It's important to not share your Boniva medication with others. In addition to taking Boniva, it's important to make lifestyle changes that promote healthy bones. This includes increasing weight-bearing exercise, quitting smoking, limiting alcohol, and eating a well-balanced diet that contains enough calcium and vitamin D. Your doctor may also recommend taking calcium and vitamin D supplements and making other lifestyle changes. Be sure to consult your doctor for specific advice. While taking Boniva, you may need to undergo lab and/or medical tests such as bone density tests, X-rays, height measurements, and blood mineral level tests. It's important to keep all medical and lab appointments. For more details, consult your doctor. If you happen to miss a dose of Boniva and your next scheduled dose is more than a week away, do not take the missed dose later in the day. Instead, take it the next morning when you remember. Then continue taking your monthly dose in the morning on your originally chosen day of the month. However, if your next scheduled dose is only 1 to 7 days away, wait until your selected day to take the medication. It's important not to take 2 tablets within the same week to catch up if you miss a dose. If you have any concerns or questions, it's always best to consult your doctor or pharmacist. When storing Boniva, make sure to keep it at room temperature and away from light and moisture. It is important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to disposing of Boniva, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.